We're going to start this off with interpretation of test results, what it means to you, and what it means about your environment. I think we should jump right in because this is going to be a very, very interesting discussion. So here we go. This is basically things that I do. I'm the editor-in-chief of these 3 journals. I'm the co-editor, sorry about that, of the journal Microbes. I'm the medical advisor to MyMycoLab, and I'm the reviewer for that 2 journals, and then I'm on the editorial board of various other journals. So, and all the information provided in this and all my presentations are to educate. I do these webinars not to make money like on the internet. I do not profit on any of this and do not promote anything for profit. So when I mention things that like certain medications or supplements, I don't get money from that, contrary to a lot of other websites and whatnot. Remember, there's a lot of experts out there who say they're experts, but they're not really. So what is the key to solving medical problems caused by mycotoxins? First, detect the cause. Second, remove the cause. Third, repair the damage and the patient is healed, not got better or anything like this. Okay. And I want to show you this slide because it was a email sent to me. And this patient said, I've been battling mold illness for close to 7 years. The entire Ritchie Shoemaker protocol did nothing. I truly believe that mold I was exposed to colonized in my body, and there's an internal production of mycotoxins ongoing. This person was correct. I've seen your videos and truly believe you might be able to help me. Please help me. I get 5 to 10 emails like this every day about the Ritchie Shoemaker, Neil Nathan, Gupta protocols that don't work. So molds, let me just hit molds in the beginning because this is important. Cellulose and other material, when they get wet for more than 24 hours, cellulose is basically drywall, and they promote mold growth. There's even some studies that show that when drywall at the factory comes off the manufacturing process, it already has mold in it. And what do mold spores do? They induce persistent changes in inflammatory and immune responses. So chronic exposure to molds induce chronic inflammation. Size matters. Hair is 100 microns thick. Spores are 2 to 4 microns. Mycotoxins 0.1, same size as viruses. We just came off a huge worldwide pandemic where tens of thousands of people died from COVID. COVID is the same size as mycotoxins. So let me ask you a simple question. When somebody was tested for mycotoxins, did they do a urine test? No. They did an antibody or PCR test, right? An antigen test. So exposure to mycotoxins is mainly by inhalation, dermal absorption, not what you eat. We'll get into that a little bit more. So a mold that produces mycotoxins produces a series of mycotoxins. One mold makes many mycotoxins. So if you have an inspection of a place, a house, a home, a business, or whatever, a building, one mold makes many different mycotoxins. The other part, if a mold is known to produce a mycotoxin and that is present in the home or building, then the mycotoxin it produces is present as well. What are we talking about? Stachybotrys, Aspergillus, Penicillium, Cladosporium, Fusarium. And remember, when we say Stachybotrys, there's 50 species. Aspergillus, there's 250 species. Penicillium, there's more than 350. Cladosporium, more than 700. Fusarium, more than 300. There's over 400,000 species of mold, but only a couple dozen affect humans. The rest affects trees, leaves, certain insects or animals, etc. But only 24 affect humans. So, what does it mean when you do a test? You go to Quest, LabCorp, or one of these tests, and you say, let's do an antibody test for molds. Well, molds are pathogens like viruses, bacteria, parasites, etc. They're living things. They are alive. They have cell walls. They affect, and what do? They're infectious. They cause infections. So when you do the usual general lab test for molds like Quest and LabCorp, and it's positive, it means that sometime that person in the past was exposed or infected by molds. So a 45-year-old could mean that sometime in their teens they got infected because of the school they were at, etc. Or if a college, it could have been the college dorm, etc. So having antibodies to molds just means that sometime you had a mold exposure or infection. It does not mean that currently you are having a mold issue. What do antibodies to mycotoxins mean? Well, mycotoxins are not pathogens. They're toxins. They're like mercury. They're like arsenic, or anything that's a chemical, formaldehyde, Roundup. You've heard of Roundup, of course. So antibodies to toxins are only present in the blood when they are present in the body. And once you treat it correctly, they fade away. If it's positive, if the antibody to mycotoxins is positive, it means they are currently in the body, that right now, not sometime in the past like pathogens. So glyphosate, mercury, etc., if you have antibodies to those, including mycotoxins, it means that your immune system is now reacting to that mycotoxin. What is the difference between IgG antibodies and IgE antibodies? Well, here is the answer. IgG antibodies to mycotoxins mean that currently that person's immune system, that patient's immune system is fighting that mycotoxin. And this could be due to 3 situations. One is they're currently in their environment exposed to molds and mycotoxin. This is indoor. Or they could be colonized by molds and mycotoxins. Or it could be both colonized and currently exposed. Let me take you to colonization. What does that mean? Well, a study done by Dr. Ponickow, chairman of the Department of Ear, Nose, and Throat Surgery at the Mayo Clinic. Well, he did a study and published it on 210 patients who had chronic sinus problems, which is known in medicine as chronic sinusitis. He took them to the operating room and cleaned their sinuses out and sent the tissues that he removed to the lab. And the lab reported back that 96% of the tissues had mold. Dr. Ponakow actually petitioned that the term chronic sinusitis be changed to chronic fungal sinusitis because it's 96% of the cause. So what's the difference between IgG and IgE? What is an IgE antibody? It indicates mast cell activation. Mast cells are found next to blood vessels and nerve endings. And in the brain, mast cells are located in 3 places: the thalamus, the hypothalamus, and the median eminence of the brain. When these mast cells are stimulated by an IgE antibody to mycotoxins, these mast cells secrete multiple vasoactive, pro-inflammatory, and neurosensitizing molecules. Mast cells in the brain activate microglia. This is a brain cell, microglia, leading to the secretion of interleukin-1 beta, interleukin-6, and TNF. These are tumor necrosis factors. So these are all pro-inflammatory, meaning they cause inflammation. The most precise and accurate test for mycotoxins are antibodies. So that means that these antibodies to mycotoxins this test is the most precise, accurate test for mycotoxins. Both IgG and IgE measurement of 12 different mycotoxins. Okay? So you have here what is the best way to find out if your patient is suffering from the effects of molds and mycotoxins. Let's take it to the next level and give you actual examples. I took out the names and I took out everything that could affect, privacy. And here is the IgG antibodies. Can you see how positive this person? It's all red. What about the IgE? Pretty much the same. You see that they have elevated levels of mycotoxins. Now, do you see this thin little line here? That's kind of a gray-blue, light gray-blue line on the left column. That is normal levels. So low positive means, yes, they're still there. It doesn't mean it's okay. How much mercury do you want? How much glyphosate? You don't want any. So these are all very positive. And here is the result after correct treatment. Not treatment with binders, not treatment with 20, 30, 40 different supplements, not treatments with glutathione. Why do I say that? We'll show you that in a little bit. But you see the one before the last, this one, gliotoxin. You give this person something with gliotoxin or NAC, it's going to make it even more toxic. Well, here's another person. This person has reactivity in IgG, but look at their IgE. That's quite significant, isn't it? Well, what does that mean? What does it mean when the IgGs are there, but so are the IgEs, but they're much higher. That means mast cell activation, as the previous slides have told you. This is typical case of mast cell activation, which can lead to what is known as mast cell activation syndrome, MCAS, mast cell activation syndrome. All of this is treated and easily treated, not with a whole bunch of other things. No, I'll tell you about that in a little bit. This is the patient 6 months later. So here is this person, and here is the 6 months later. It's still high, but it's much less in IgG and much less in IgE. Why? Because they had a lot of reactivity, a lot of immune reaction. So they're going to need maybe a little more treatment to finally get it back to normal. Here is another patient's lab tests. Again, you see that in IgE, GG on the left, they're very high for mycotoxins called vomitoxin, or known also as deoxynivalenol. And I'll get into that one and why it's so high in so many people. But if you look at the IgE on the right, this person is reacting a lot. So again, this person has this mast cell activation, and they're going to complain of a lot of brain issues and a lot of gut issues. Here's another person. Again, elevated vomitoxin, but elevated in all these others. And you see, they're elevated for gliotoxin. Don't give them glutathione, which is so popular on the internet. Here it is on the right side. They're also reacting. Not real strongly, like all the way red, but they have both reactions. IgG and IgE means they're currently exposed in their home or at work or at the gym, or maybe it's in their car. So, and I'll get into each one of these as we go along. And there's a question, are you planning to add citrulline? Yes. So here is a person with less IgE, but more IgG. And you can see that the gliotoxin is high. Again, no glutathione, please. And I'll show you why. But I'm going to explain to you why NAC and glutathione is so bad for gliotoxin. Let me ask you, since you that question, do you read the medical literature, or do you just go to Google, Dr. Google, and rely on those answers? You should rely on what is published in studies, okay? So let me show you what the 12 different antibodies are. These are these are the antibodies. So these are the 12 most common mycotoxins that affect human beings. Again, there's over 400,000. There's not that many but mycotoxins that affect human beings are these. You asked about glutathione increasing toxicity. Well, this study was published in 26. This is quite way back, and this is what it said. These results indicate that glutathione promotes gliotoxin-induced cytotoxicity, probably by reducing ETP, disulfide bridge, to the dithiol form, which is basically molecular medicine. So this tells you, do not use glutathione. This is the explanation, and it goes back not a couple of years, but it goes back to 2006. And there's many more studies. I just used one to, so I don't have to show a bunch and use a lot of your time. Let's go a little further. What does cross-reactivity mean? A positive test for mycotoxin antibodies will cross-react with other tests because it's a toxin. Typically, in patients I see, this gives positive Lyme, positive CMV, EBV, blah, blah, blah. So HSV6, HHSV6, etc. But the patient is because it's cross-reacting, the patient does not have Lyme, CMV, I'm sorry, it's EBV, not EBC, EBV, CMV, HHSV6, and a bunch of other viruses. By the way, how do you test for a virus? You test by an antibody test. The question comes, if you don't test positive for gliotoxin, is there any place for glutathione? Absolutely, you can use it if there's no gliotoxin reactivity. So what is this vomitoxin? Why is it so high? Because it comes from a mold called Fusarium. And there's over 300 species of Fusarium. And Fusarium is a mold that produces large amount. It's stated in several medical journal articles as copious amounts. And Fusarium is widespread in contaminated indoor environments. So it colonizes the respiratory mucosa. What do I mean by the respiratory? There's the upper respiratory, which is in the cranium, in other words, the nasal sinuses, etc., and the lower respiratory mucosa, which is the bronchioles and the lungs. And interestingly, during dissemination, Fusarium can adhere to foreign things such as indwelling catheters, artificial heart valves, joint replacement, and grow on these these implanted devices. But fortunately, the acute intoxication from food is low in developed countries where the amount of mycotoxins in foods is controlled by the authorities. So yes, you get Fusarium and vomitoxin in certain parts of Africa and Eastern China, because it's not once the grains are harvested, how they store them is not good. Now, whether these can grow on dental implants, it's possible, but there's nothing in the medical literature, not Dr. Google, but in the medical literature, the actual medical and scientific evidence say they don't mention dental implants. Okay, so let me take you a little further on this Fusarium. Because of serious concern for animal and human health, regulatory guidelines levels for vomitoxin or deoxynivalenol in food and feed are enforced in more than 40 countries. So the likelihood of you getting this from food does not exist, contrary to what you read in Dr. Google. But again, this is a study. It was published 11 years ago. Okay. And again, it mentions the intestines. Okay. So how much deoxynivalenol do you need to eat to show up positive? Look at the last 3 lines. In an adult weighing 170 pounds, you'd have to eat 14 pounds of rancid, foul-smelling, foul-tasting oatmeal, or 20 slices of contaminated bread, also smelling horrible and rancid, to exceed the and have a toxic reaction. So no, you don't get this from food. You get it from the indoor environment, as it tells you here. Widespread and contaminated indoor environments, not food. Let's look at the latest studies on urine testing for mycotoxins. The variability, this is from this study that was published in October of last year, a few months back. They're saying that because the concentration in urine is based on daily intake, it demands urine samples at different times of the day. Okay, and the inter-individual comparison of mycotoxins is challenging because various factors such as gender, age, diet, muscle mass can influence creatinine secretion. So it's not a good test. It's not a good way of testing. And also they showed that the ELISA method, which is the same one that MyMycoLab uses in blood, in human serum, blood serum, has significant accuracy, precision, and specificity. I have a question coming up, and this was published just in October 2022, a few months back. So how does vomitoxin affect estrogen, testosterone, lower or raises? It lowers testosterone, and I discussed this in a webinar I gave on how mycotoxins affect hormones. And if you go to my YouTube channel, you can watch that webinar. It lowers testosterone in men to the point they're almost sterile. In women, it affects 3 hormones especially, all hormones, but 3 especially. Thyroid hormones causing autoimmune thyroiditis, which is known as Hashimoto's. And the other, it changes your estrogen and progesterone levels. So it affects women as well with all kinds of problems that relate to their hormones, especially if the woman is of menstruating age, which is about from their early teens to their 40s. Again, this is October 2022. So yes, hormones are affected by mycotoxin called vomitoxin. Here's what, okay, let me go back here. Here's I had an email on Monday from a doctor who was taking a course, and Neil Nathan used 2 or 3 studies from 2013 showing that urine testing for mycotoxins. So what did the United States look at and published in February 2015 is that unvalidated, the urine test for urine mycotoxins is an unvalidated test for the clinical diagnosis of illness. So folks, those of you who think it's the gold standard, guess what? It is not the gold standard. This is the gold standard. And would you believe that I was at a medical conference and I gave a lecture on molds and mycotoxins. And 3 people came to see me after the lecture. These are family nurse practitioners, FNPs, from the state of Oregon. The 3 are from 3 different cities in Oregon. And they said they're getting a lot of pushback from naturopaths because they were not using the urine test. They were using the real gold standard. But that was not accepted by these naturopaths in their communities, and they got a lot of pushback. Okay. So what is the difference between a urine test and a blood test for mycotoxins? Serum blood testing is highly precise. It tells you if you have mycotoxins for a moldy indoor environment. The urine test changes because it measures mycotoxins excreted from foods, not from your indoor environment. So therefore, it can change day to day, week to week. And I have a lot of healthcare practitioners who says that the urine test, they were always concerned with the urine test because it didn't fit the clinical picture. So what is meant by the clinical picture is that they'd have a patient really sick and the urine testing was kind of so-so. And then when the patient was healed after treatment, they repeated the urine test and it was very high. That doesn't happen in blood. Blood does not lie. Urine testing depends on how much you drank that day, how much fluid you drank that day, what you ate that day, etc. So, Dr. Rajdani, who's published well over 200 medical journal articles, asked me this question: what is the source of mycotoxins detected in the urine? You don't detect things in the urine from the environment. And he stated that this is because most of the mycotoxins detected in urine originates from food. And this is why the detection of mycotoxins in urine is not an indication of body burden of mycotoxins and should not be used as a biomarker of exposure to mycotoxins in water-damaged buildings. It's clear, okay? So this is why the testing in blood is highly accurate, 97%. Okay. Let's talk a little bit about treatment. The first rule of toxicology is get the patient away from the toxin or the toxin away from the patient. And simultaneously build back up the immune system with supplements while giving an antifungal. So I get all these questions. Oh, I read on the internet that itraconazole is really bad for you, and it can do all kinds of things to the liver, and oh, it's terrible. Oh, don't use antifungals. Well, let's look at that. First, person's health cannot be restored if they continue to be in the place where they're exposed to molds and mycotoxins. No treatment will work under those conditions. So please, before you begin treatment, make sure they're no longer being exposed to these molds and mycotoxins. And then don't give them fluconazole. There's two types of molds: single cell molds and multi-cell molds. Okay, single cells are the yeasts that are used to, for making bread, help bread rise, help make alcohol, beer, and various other things, okay? And it's called fluconazole diflucan. It does not affect the other molds that are multicellular: Aspergillus, Stachybotrys, Penicillium, Cladosporium, Fusarium, and all these others. But itraconazole hits both. Let's go a little bit into the safety of itraconazole. Itraconazole, also known as Sporanox, is an antifungal agent that was developed in the 1980s. Has been in clinical use for 35 years with an established safety record. Okay, and here's the title of a study published 2 years ago. And I just put the title of voriconazole because I use both itraconazole in certain cases and voriconazole in certain cases. Okay, the study states that voriconazole used in critically ill patients with acute on chronic liver failure and continuous renal replacement therapy is fine. They don't get sicker. And those are pretty sick. These are critically ill people. Okay? So here's the study that was published 3 years ago. Okay? Itraconazole is a broad spectrum triazole antifungal, and it has favorable pharmacodynamic and pharmacokinetic profiles and is available both as oral and IV. Itraconazole has proven to be a valuable addition to the antifungal drugs currently available for treatment. It's been well tolerated with doses of up to 400 milligrams per day, being generally free of serious side effects. I and my patients use 100 milligrams of itraconazole twice a day. So can you use the itraconazole comes in a capsule. You can use it 2 ways. You can either open the capsule and put it in some liquid or something like, I don't know, applesauce or, whatever you want, and drink it down that way. But itraconazole also comes in a liquid because it's used in children. So you can use it in children. And for the liquid form, it says use this many milligrams per kilo of body weight. So yes, you can use liquid, you can use the capsule, you can open the capsule and put it on something or in a, I don't know, some sort of juice or whatever you choose, and it'll be okay. Okay. So when do I use itraconazole and voriconazole? Itraconazole is really like the base antifungal. If a person is very critically ill, I mean, to the point where they're really having serious health problems, then I'll maybe give them voriconazole instead. The other question is, since mycotoxin antibodies cross-react with EBV and can antibodies to EBV cross-react with mycotoxins? Well, let me take you back to that. Okay. So, here is the cross-reaction. The cross-reaction is because it's a toxin. Okay. And a toxin is much more toxic because it's not a pathogen. I'm trying to find that. Here's the slide. They're toxins, not pathogens. So the other way around, no. One is an infectious disease, viruses, bacteria, Lyme is a bacteria, etc. No, they don't go into the toxins. So just to kind of show you that. All right, coming back to where we were. Here's the itraconazole versus voriconazole and the safety of these. Here's a gal, SIBO. And people get treated for SIBO with all kinds of this and that and the other. And I mean, they're suffering for not a month or two, but years. June to September. How long is that? That's the entire month of June, July, August. 3 months. Look at the results. This picture was taken by the patient. So be aware that that the World Health Organization calls mycotoxins the great masquerader of the century. It masquerades as SIBO, fibromyalgia, chronic fatigue syndrome, autoimmune diseases. So I've treated over 15,000 patients affected by molds and mycotoxins. So obviously over the last 30 years, I've had a lot of experience. But here's the key. If a healthcare practitioner uses the right diagnostic test and the right treatment, 6 months or so, the patient will be well again. If they use the wrong test and the wrong treatment, what happens? Let's look at the next slide. Healthcare practitioners treat the lab result and not the patient. Bartonella, Babesia, Lyme. I asked this one doctor who says, my patient also has Lyme. I said, okay. Did they have a fever of over 100.5 Fahrenheit for over a week and have migrating joint aches and pains so that it was difficult for them to get out of bed and go to the restroom or something? I don't know. So they're treating a Lyme test. They're not treating the patient. They didn't ask if you had these symptoms. Now, make sure you don't treat a test result. Make sure you ask the patient about what their symptoms were. Okay, binders. This is the great delusion. Medical evidence, fact and truth. Binders, here's the only study on binders in humans. There's many studies showing binders work in animals. Read those studies. They all mention animals. They don't mention humans. Okay? Binders rely on the absorption of mycotoxin from the gut, preventing them to get into the bloodstream. Agreed. And here's the different ones that they use. Bentonite, clays, activated charcoal, zeolite, blah, blah, blah. They affect only one mycotoxin, affiliations. They do not affect all the other mycotoxins. And on top of that, they also bind vital vitamins as well as macro and micro elements. For example, they will also reduce estrogen. Now, this study, you see it at the bottom, you can look it up. This is not an internet opinion. This is a published medical and scientific evidence, which is what I'm trying to teach you. Use medical and scientific evidence, not opinions and anecdotes from the internet. Oh, my patient, blah, 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 and I gave him this and it helped them. That's not evidence. Evidence is studies that are published and where they really looked at it carefully. Now, the reason I bring this is, how common is affiliations? Well, this table summarizes the concentration of mycotoxins in parts per billion. There's 3: aflatoxin, ochratoxin, and trichothecenes like saprotoxin, stachybotrys, etc. Look at how much aflatoxin they found. None. It's very rare. It doesn't help. Okay? If you're using binders to get rid of aflatoxins, it's not helping your patient because they have these other ones. So I'm hoping you understand what I'm trying to show you. Here's another one. People using the ERMI test. 10 years ago, in 2013, the United States EPA showed that ERMI is not the test to use. Don't go using an ERMI test. Instead, what should you use if it's not the ERMI? Here, this is an article that was published in 2022 in Mycotoxin Research. How do you do it? In order to provide a secure identification and characterization of indoor mold exposure, directly contaminated building materials, swab samples, and sampling of air on different media, not just an air trap, but object slides, petri dishes with filter material and agar, with subsequent microscopic or morphological differentiations, are more reliable than alternative applied in routine analysis. This is what you need to do, not ERMI. And this is 2022. I'm giving you the latest studies and information, and I'm giving you the citation so you can go to the medical literature and read it yourself. Go to pubmed.gov and look it up. Don't look it up on the internet. It's full of opinions. Do you know that there's a website on the internet that says the current problems with climate change is really because the earth is flat? That's what you get on the internet. Here's what I call another win. Young mother of a 3-year-old called last week to order her retest after 6 months of treatment. And because you should retest every 6 months, not 3 months or 1 month as they tell you to test for urine. 6 months. What happened to her? She had daily loss of equilibrium and vertigo. She had it for 8 months. Can you imagine having this loss, vertigo and disequilibrium for 8 months and having a 3-year-old? Her constant muscle spasm and numbness are gone. Again, the right diagnosis, the right treatment. Her visual problems are gone, as well as lightheadedness, MS symptoms, Parkinson's symptoms. She's sleeping better. Her mood is elevated. She's feeling like herself again. And she found it horrifyingly amazing that all of the MRIs, neurologist specialists had nothing to offer. The right treatment, and if you want the right treatment, again, go to my YouTube channel and watch the treatment paradigm webinar. It's right there for you. It's simple. It's not all 20, 30, 40 different supplements and whatnot, and binders and cholestyramine and all these things don't work. As I showed you in the third slide, you remember that third slide, the Shoemaker method lady who used the Shoemaker Neil Nathan protocol for 7 years and was still sick? Okay. And here's another doctor that's a healthcare practitioner. Just talked to another client, a man who was suicidal, overwhelmed, very ill, mold sick, fatigued, could barely function, not able to work. And now he's living the dream. He's working. He's feeling great, living life, ordering extra mycotoxin test kits to share with his family. He's extremely grateful. And this practitioner said, as am I. Remember, when you do a test for mycotoxins and you get the results, we can do a Zoom call to go over them together. And I can help you with this, like I helped this healthcare practitioner and the previous one, this one, and others. It works. I've had 30 years of doing this. And here's a patient. Thank you for the gift of mycotoxin antibody test, and thank you for the gift of help. Okay? So the old test is on the left. The new test is on the right. You see how it came down? No, and you know where it was for this patient? It wasn't in the home. They tested the home. It was her pickup truck. They bought a petri dish and put it on the front seat of the pickup truck. In the afternoon, the next day, in the morning, they looked at it, it was covered with what? Mold. Grew over the whole petri dish. Remember cars. So what I want you to remember in all of this is use the right treatment. Let me go back to the beginning and go over some of these tests. So use itraconazole. Use the right combination of supplements that these patients need. Let me give you a for instance. Mycotoxins are known to cause demyelination in the brain and in the peripheral nervous system. And in this peripheral nervous system and in the brain, phosphatidylserine has studies that show that mycotoxins that cause demyelination with phosphatidylserine. These are double-blind, placebo-controlled, randomized studies. These are the gold standard in medicine. They help remyelinate. Here's the patient, before, after. You see how it works? This is 6 months after. Okay, so before to after. Here's a patient with real bad mast cell activation. Here's a patient that has a little bit of more mast cell activation. So they're going to have more gut brain issues. What do I mean by that? Brain issues, short-term memory loss, brain fog, headaches, sleep disturbance, etc. Here's another test. This is, again, IgE antibodies. And by the way, the question is, where can they buy the Petri dish? That particular patient, it's her husband, and he went to Home Depot and got the Petri dish from Home Depot, and she got better. So please use the right treatment. Use the testing done by MyMycoLab. Use the right, again, with the right treatment. The ELISA method has significant accuracy, precision, specificity, which is what you want for your patient. So you can treat them and then watch the treatment paradigm, not protocol. One size fits all, the same protocol for a woman that's 22 years old and has and weighs 120 pounds versus a male that's 55 years old and weighs 220 pounds, and they get the same protocol. It doesn't work. You have to individualize the treatment. Remember, it's not validated to do the urine test. This is what you need to do. So make sure the patient is no longer exposed to the mold before you start treatment, because otherwise nothing is going to work. What is the dose for phosphatidylserine? Claire Products has 2 types of phosphatidylserine, and I use Claire Products for some of these. It's the one that has the 500 milligram, not the 100 milligram. Okay. So the other question here is, it states, I understand IgG and IgE mean current exposure and not exposure from years ago. But can a current exposure indicate an exposure that was recent, like 2-3 months ago? Absolutely. Or is it limited literally to the current? Because once you are exposed, guess what happens? Those mold spores get inside you. Okay, you breathe them in. They're 2 to 4 microns thick, meaning they go to the deepest part of the lungs, to the alveoli, and cross from the alveoli into the blood circulation. So this is what you need to remember. And again, there's more information on treatment for these patients in the treatment paradigm on my YouTube channel. And again, if you want me to help you, just email me, Immune Doctor. I'm going to put it in the chat, and I answer all emails. Also want to mention that every other week, like next Wednesday, I have a tea time for Dr. Campbell. And this tea time is where you can write in and ask me questions about anything, heavy metals, Lyme disease, goodness knows what. I've been a doctor for a long time. I've published over 100 studies. I'm the editor-in-chief, co-editor of 4 different medical journals. I read medical articles all the time, which gives you the evidence, the medical and scientific evidence, not the opinions. This website says this, that website says that, and so on and so forth. Get the real skinny. Why? You want to help your patients. You want them to get well, not just get better. Watch the treatment paradigm so that you can really make a difference for your patients. And remember, let me take you back up to the first slide, or one of the first slides. Here, detect the cause, remove the cause, repair the damage. Okay? So, yes, I was sent a screenshot. That's the right one to use. That's the correct one. Anyway, this is the key. I lecture at 4 different medical schools, and this is a slide I use in every one at the beginning. So, do you give supports to patients who are sensitive? Why are they sensitive? They're sensitive because this issue of molds and mycotoxins. Oops, sorry. And so, as a result, they become sensitized. They can get sensitized. They can't walk down certain aisles at the supermarket because the smells and the odors. Like, for instance, where there's the part where there's chlorine and a dishwasher and washing liquids, etc. Because these smells make them sick. They can't wear a perfume they used to love to wear. They're limited. So use this as it'll lower that part of their sensitivity bit by bit. And if you give them too many supplements, they're going to be very sensitive. So use the combination of right supplements. And I don't give them that many. I give them maybe 6 or 7. That's all they need. They don't need 20, 30 supplements. Okay? So, please type in any messages for me. I'll be happy to review them with you. Or if you want to email me, use my email address, immunedoctor@gmail.com. And come and watch me next Wednesday and ask me any questions at tea time with Dr. Campbell. Now, 2 weeks from now, I'm going to discuss autism. I see a lot of autistic children. Studies from several medical centers, Tufts University School of Medicine, Rutgers University School of Medicine, all those will show that 60%, 2/3 of autism is caused by mycotoxins. So I see a lot of children who are autistic, and within several months, they're fine again. They go to regular school. And I have moms and dads. Listen, I had a patient. He was really affected by autism and hadn't spoken a single word. He made sounds and he had repetitious movement. He was 19 years trapped in autism. And what the treatment got him well. And the father, mother, and him came to see me for their last visit. The father was crying because his son now could go to school, could go to university, and not be affected by autism. How do you address constipation while on itraconazole? Well, I'll tell you what, go to the treatment paradigm I have. Basically, I use spore-forming bacilli to repair the damage of the microbiome. 80% of your immune system is in the microbiome. So if you don't use, if you use, okay, let me get into science and medicine. Dr. Simon Cutting at the Reading University in London did studies on probiotics. What are the common ones that you find all over the internet? Well, lactobacilli, bifidobacterium. Okay, he found in his studies that over 90% of these two bacteria, bifidobacterium and lactobacilli, die in the stomach from the acidity in the stomach. And then he looked for what probiotic does work. And he found that spore-forming bacilli really go to the gut and start and are probiotic. So use a spore-forming bacilli. I use Megaspore Biotic in all my patients, including children, including kids with autism, including adults. And I treat everything from kids 2 to 3 years old all the way to adults in their 90s. I've been doing this for more than 30 years. Again, I've published over 30 medical journal articles and chapters in medical textbooks that explain all this. And by the way, these articles are not with just me. They're with a group of doctors from various parts of the United States. Right now, I'm involved in a study with the University of Helsinki in Finland on how to treat patients affected by molds and mycotoxins. Why? Because Finland has the highest rate in the world of dementia. And they did studies on the brains of patients who died of dementia. And when we say dementia is several different disorders. Of course, Alzheimer's is the number one. That's 80%. Okay. And so Parkinson's is the next one. That's why Parkinson's can be treated. That's why they find mycotoxins in Parkinson's patients. But 38% of patients' brain who had died with Alzheimer's disease had mycotoxins in their brain. So brain is the first place mycotoxins are. Has MyMycoLab been validated? Absolutely. By the way, this antibody testing has been around for more than 20 years. So it's not something that happened. So thank you for being here. Thank you for listening. Let me know if you have any questions by emailing me at my email address, immunedoctor@gmail.com. Thank you so much. And next week it's next Wednesday, it's tea time with Dr. Campbell. I actually drink tea. And in 2 weeks, it's going to be on the issue of autism, which is so prevalent in children and getting more and more prevalent in children. Thank you all. Have a great night.